welcome to yet another episode of Focus on Health, a show that creates awareness and informs you on matters health. World Hepatitis Day is celebrated every year on the 28th of June. But what exactly is hepatitis? Does it have a cure, and how can it be treated?
Mapping hepatitis in Kenya. A study of the different kinds of hepatitis in Kenya showed areas where the government can focus its effort to prevent infections. One of the findings was a surprise. Giving adults the hepatitis vaccination had been ignored. This is a waiting time bomb and an area for action that could have been overlooked. Hepatitis is defined as inflammation of the liver. One symptom is yellowish eyes and skin, also known as jaundice. The most common cause of hepatitis is viral infection. Viral hepatitis is a public health concern globally. It is difficult to count exactly how many people get hepatitis or how many die from it. One reason is that the infection is caused by 5 types of viruses named from A to E, and they are passed on in different ways. The other reason is that hepatitis deaths are not linked directly to liver infection. Death may result from gradual damage to the liver. The number of people affected worldwide is known to be hundreds of millions. Kenya's hepatitis milestones. Kenya has put in place the following preventive measures to manage hepatitis-related infections. 1. Developing national guidelines on the prevention and management of viral hepatitis. 2. Screening all donated blood and its products for transfusion. 3. Vaccination of health workers against hepatitis A and B. 4. Providing safe sterile needles for syringes. 5. Introduction of hepatitis B virus vaccine in the immunization schedule in 2003 to prevent mother-to-child transmission.
That was the very informative feature of the day, and with me I have Daktari on set. Thank you very much, Daktari, for joining us.
You're welcome.
Daktari, even before we head on to our topic today, which is hepatitis, the silent killer, kindly introduce yourself to our viewers.
Yes, so hi viewers, my name is Dr. Mutinda. Welcome to Bliss Medical Center. Yeah.
Thank you very much, Daktari. So,
You're welcome.
Daktari, how would you describe hepatitis in the layman's language?
Okay, simply put, hepatitis is an inflammation of the liver and the liver tissues.
Okay.
Yes.
And what causes this inflammation?
So there are many different causes for hepatitis. We can group them into different categories.
Okay.
One common one is infections. You could have viral infections, you could also have bacterial and parasitic infections as well. Another one is metabolic.
Okay.
This could include toxins or other illnesses in the body affecting the liver. So this could be medications, this could be poisonous substances, because one of the main functions of the liver is to detoxify your body. Most of these things, when they do end up causing damage, it would be the liver that will be hit first.
And then toxins, could alcohol also be one of the causes?
Yes, alcohol definitely is one of the causes, because the same thing, it is broken down and processed in the liver. And when the amounts taken in are very excessive, I think usually the recommended, of course, limit is maybe 1 or 2 units of alcohol per day. But when you exceed this regularly, you exceed the capacity of the liver to process the alcohol, and this eventually damages it slowly over time.
Actually, we have so many people suffering from hepatitis that most of them do not know that they're suffering from it. How do these symptoms manifest themselves? How can someone tell that they're suffering from hepatitis?
Okay, so some of the symptoms are a bit non-specific initially, unfortunately, like with most illnesses. So you may find that someone is feeling nauseous, they're vomiting, you're losing your appetite, there's an unintentional weight loss. One of the earliest clinical signs that you can see is yellowing of the skin and of the eyes. Yeah.
Oh, so those are just basically the signs that we have. Do they vary depending on the type of hepatitis?
They vary depending on the extent of the damage. And of course, with more extensive damage, more features you'll have.
Okay.
Yes.
What are the types of hepatitis that we have, and could you take us through them?
Okay, so when it comes to the infectious hepatitis, some of the common ones are hepatitis A, caused by the hepatitis A virus. This is, how do I put it? It's a diarrheal disease. Okay, it's like kind of like a food poisoning. Hepatitis A and E are both food poisoning borne illnesses. Hepatitis B is an illness transmitted from transmission of different bodily fluids. Hepatitis C also is another virus, and hepatitis D is one that also is transmitted in a similar way.
Okay.
When it comes to alcohol, the illness itself is called liver cirrhosis.
Okay.
So what happens is with repeated damage, first you start getting fatty changes accumulating in the liver, and over time you get these fibers like forming, replacing the healthy tissue, and they're not, the liver is now therefore stopping to work properly over time. So that's liver cirrhosis.
We've talked about hepatitis A to E. Which one is the most prevalent?
Most commonly you'd find patients getting hepatitis B and A. Yes.
And how is hepatitis B contracted?
Hepatitis B is contracted by mixing of bodily fluids. It is actually quite infectious. So common things as like sexual acts, being in close proximity with someone, maybe sharing close items with them when and also commonly for healthcare workers when it comes to taking bodily samples, maybe blood, and if they were to injure themselves in the process, you put yourself at risk.
What about drug addicts when they inject themselves? Could they be at risk for
Yes, definitely, because you tend to find that people share these needles, and one person having it, the direct contact from one person's blood to another is immediately a risk for infection. Yeah.
So basically just any blood contact?
Blood and bodily fluids. One simple way to think about hepatitis B is just like HIV. Yes, in terms of the bodily fluids and how it's transmitted.
I read somewhere that hepatitis is actually easier to transmit than HIV. Why is that?
So depending on the kind of virus, hepatitis B is just very infectious. You see, like for example, when we talk about illnesses and how easy it is for them to transmit, each of them varies, and it just depends on how successful it is. So currently right now, we're going through a pandemic with COVID. COVID is also a highly transmissible disease. And what they usually check is how many people can one person infect. Yes. So for hepatitis B, it's just one of those illnesses where a small little exposition to such a person, you could easily contract it.
And when you have, let's say, a blood stain, for instance, the HIV blood stain can last maybe on a surface for just a few hours. What about hepatitis? Does it last longer?
I'm not sure, but it does last for quite some time as well. Yeah, I'm not sure for the exact figure how long it will be. Do
we have a particular type of demographic or maybe gender that's affected by hepatitis?
The most specific demographic actually is healthcare workers. Oh. Yeah, because most likely even if someone gets unwell and you come to the hospital, you need procedures done, you need to be examined, the doctor has to put their hands on you to check on you. Our doctors tend to be at the highest risk. Doctors, nurses, pretty much anyone in healthcare. And it is actually routine for them to get vaccinations to protect them from the same. Yes.
And literally, when you go to maybe the cosmetic industry, we have people going through manicures, pedicures. If someone maybe gets hurt through that process, could it also transmit hepatitis?
Well, if the institution itself doesn't have cleanliness standards and maybe someone was exposed before, some of the bodily fluids maybe remained on the materials and they weren't, too careful about that, then the risk is definitely there.
Okay.
Yes.
And what about tattoos? Could that also put you in the risk of hepatitis?
Yes. It is basically piercing your skin. Okay. If the needles are shared between people, it is a direct introduction into your body from someone else's, yes.
So I'm guessing that also includes cultural activity or practices like maybe the FGM, the rituals and all that?
Yes. People definitely need to be quite careful about like the cleanliness and the procedures followed to ensure the same.
Okay. So Dr. Hold that thought. We are going to take a slight commercial break. And when we come back, Dr. is going to be telling us about how hepatitis can be treated and does it have a cure. But first, I will leave you with the beginner segment.
Did you know who is at risk of getting hepatitis? You are at risk of getting hepatitis if you 1. Share needles to take drugs. 2. Practice unprotected oral and/or anal sex. 3. Having many sex partners. 4. Drinking significant amounts of alcohol. 5. Having poor nutrition. 6. Work in a hospital or nursing home. 7. Receive long-term kidney dialysis. 8. Travel to areas with poor sanitation. How can I protect myself against viral hepatitis? There are many ways you can reduce your chances of getting hepatitis. 1. Get the vaccine for hepatitis A and hepatitis B. 2. Use a condom during sex. 3. Don't share needles to take drugs. 4. Practice good personal hygiene such as through hand washing with soap and water. 5. Don't use an infected person's personal items. 6. Take precautions when getting any tattoo or body piercings. 7. Take precaution while traveling to areas of the world with poor sanitation. Make sure to get your vaccines. 8. Drink bottled water when traveling.